Hello, I'm Dr. Nancy Bellucci, and the presentation I'm giving today is entitled Learning in a Disruptive Healthcare Environment. This presentation will include an overview of the literature review performed on the prevalence of disruptive behavior and horizontal violence, discussion on the four emerging themes from the review, a working definition of disruptive behavior, an explanation of what is currently known on the topic, discussion on the incidence, prevalence, and impact of disruptive behaviors, a review of the student nurse's perspective, and the benefits of resiliency training. This presentation sheds light on the prevalence of disruptive behavior and horizontal violence that is impacting students and seasoned nurses alike. The research articles and healthcare regulatory information reviewed for this presentation conveyed that nursing students need strategies to manage situations where these behaviors are present. Although much has been written on the topic in healthcare, there is little research that explores how this phenomenon impacts a nurse's ability to learn in the presence of it. The review of the literature indicated that few studies are available that serve to explore the development of students who encounter hostile behaviors in the clinical setting. This presentation will provide an overview of the pervasiveness of disruptive behaviors and horizontal violence in the healthcare setting. Although there are regulatory requirements for organizations to implement and follow to prevent it from occurring. Further, this presentation will attempt to illustrate the issues horizontal violence causes related to retaining nursing students. A recent review of the literature included 22 sources, 19 peer-reviewed articles, and 3 healthcare regulatory documents, and incorporated lived experiences of the principal investigator and a nursing educator and program director for both graduate and undergraduate nursing programs. The purpose of this study was to examine the pervasiveness of disruptive behavior and horizontal violence in clinical and academic education settings, and its impact on students' ability to learn and think critically. The study intended to establish a correlation between the incidence of horizontal violence in nursing education and the impact on the nursing students' ability to learn and think critically. Further, the presentation will provide an explanation of the ways that resiliency training may contribute to persistence in a nursing program and as a nurse in the field. There are 4 emerging themes as depicted here. The first theme was that students experience a feeling of lack of acceptance when experiencing horizontal violence. The second was that students expressed an impeded ability to learn. The third were concerns for safety. And the fourth, a failure to persist in a nursing program, therefore increasing the nursing shortage. The need for new nurses is growing, concerning the impending and encroaching shortages. To increase the number of new nurses, nursing students must be afforded the opportunity to learn in an environment conducive to learning. Thus, the nursing clinical environment must be managed effectively to prevent the occurrence of horizontal violence and to address the issue as it arises, to promote critical thinking and effective learning for nursing students. To date, there is little that is known regarding the extent to which the student nurse perceives that his or her learning is affected upon witnessing or experiencing horizontal violence. Therefore, this topic is pertinent and it pertains to advancing nursing education. So when we look at defining disruptive behavior, it's also referred to as horizontal violence or bullying behaviors. And they are behaviors that have the potential to influence the ability of the nursing student as he or she is learning to use critical thinking skills and to perform safe patient care. Horizontal violence is a set of behaviors that potentiate impairment of one's ability to critically think or to safely perform in the role as a nurse and inevitably as the student while serving to undermine patient confidence. The literature suggests that horizontal violence creates a serious negative impact on patient safety, quality of learning, effective clinical judgment, and the ability to attain confidence on the part of the nursing student. The Joint Commission defined disruptive behavior, such as horizontal violence, as behavior that undermines patient safety, detracts from patient satisfaction, promotes adverse outcomes, increases the cost of care, and causes attrition in the healthcare workforce. In 2008, a rise in prevalence reporting regarding disruptive behavior created the need for the Joint Commission to survey over 1,500 providers via email questionnaire. The results of the survey gave birth to the organization's new regulatory guidelines that impacted over 15,000 healthcare institutions in 2009. So what is known? The presence of horizontal violence in nursing is prevalent. A nurse's experience with horizontal or lateral violence is reported by almost half of the nurses at some point in their career. Researchers have reported that the prevalence of lateral violence ranges from 87.4% in the operating room to lower levels in the medical surgical unit. It was also reported that lateral violence creates adverse events 67% of the time, medication errors 67% of the time, compromises patient safety 58% of the time, impaired quality of performance 68% of the time, and increased patient mortality at 28% of the time. So when we look at incidence and prevalence, as a result of the elevated numbers of incident reporting related to bullying, back in 2008, the Institute for Safe Medication Practices, ISMP, performed a survey again in 2013 to identify whether or not progress has been made to curtail disrespectful behaviors in the healthcare work environment. In that same year, a survey of 4,884 respondents was conducted. 73% of the respondents encountered negative comments about colleagues, while 68% of those surveyed experienced condescending or demeaning comments. According to the current research, the incidence and prevalence of disruptive behavior in the healthcare environment are still of significance. In 2022, a systematic review and meta-analysis of 27 studies since 2014 was performed by Zhang and team and uncovered that lateral violence in the nursing workplace persistently occurs at a rate of 33.08%. The highest report of lateral violence was reported to occur between nurses. Although strides have been made by healthcare organizations, such as the Joint Commission, the ISMP, and other healthcare regulatory bodies, the persistence and prevalence of lateral violence has not waned in the last 10 years. There's a pervasiveness of this behavior, at least reported behavior, since 2008. Disruptive and bullying behavior, such as horizontal violence, has been consistently prevalent in healthcare work environments. It was more frequently reported and studied since 2008, but it occurred before then. When reviewing the literature on the topic, there is still a stark correlation between the pervasiveness of these behaviors and a negative impact on patient care and the ability of the nursing profession to thrive in its collective numbers and professionalism. Other research provided early evidence of bullying in the nursing workplace globally. Another study correlated with the findings of the Joint Commission study, which indicated that there was a rise in incident reporting related to bullying acts. Widely reported in the literature was the impact that disruptive behavior and bullying had on patient safety. Back to that research performed in 2008, which revealed critical insights into the need for greater attention to the relationship between disruptive behavior and adverse patient safety events. So when we look at the impact of disruptive behaviors, they have debilitating side effects. Over time, disruptive behavior wears on a person and chips away at the enthusiasm one musters each morning on the drive into work, until one day you look in the mirror and you're not sure who is staring back at you. A side effect of disruptive behavior could be equal to working while impaired. Working while impaired means that one is working under the influence of a substance, mental condition, or anything that causes the person to not function in accordance with policy or accepted practice, or whose judgment is impaired. When a person is demeaned or feels threatened, it is at the receiving end of lateral violence or has lost confidence in the workings of the work environment. The natural human response is to be emotional and preoccupied. In other words, working while impaired. So as you see in the diagram, Some of the main issues and side effects associated with disruptive behaviors are reduced enthusiasm for work, loss of confidence in your own work environment, heightened emotion, preoccupation, and impaired ability to work or critically think. So let's look at some of the themes. Lack of acceptance was one of the themes. It was the first trend that emerged when examining the literature for obstacles experienced by students in the presence of horizontal violence. In 2006, a research study suggested that while clinical placement in nursing education is important aspects of learning, students receive negative reactions. Many students who are trying to find mentors to assist in their final aspect of baccalaureate programs receive no support from their colleagues and struggle to complete the practice experience requirements needed to graduate. In 2008, a study revealed that this lack of acceptance of the nursing student from the nursing staff creates obstacles to learning and effective communication. It's been reported that this has even tripled in its incidence and prevalence since the pandemic.